In this presentation, I'd like to talk a little about the role of community pharmacy in the management of COVID-19. For me, COVID-19 is a bit of a deja vu feeling. I was working in China, living in Beijing in 2003, when the first SARS epidemic broke. I heard stories from Guangzhou and then Hong Kong, and it seemed very far away because Guangzhou is as far away from Beijing as Rome is from Dublin. Very soon after, cars driving into residential areas where I lived would get sprayed by men in the full masks on the top and underneath with disinfectant. A day later, a small settlement down the road from us, 5 minutes away, had a cluster of cases. So the army moved in, cordoned off the area and stationed tanks and armoured cars outside. No one out, no one in. The entire epidemic claimed 774 people, and 2 of those lived on my road. SARS-2 or SARS-CoV-2 has already 16 to 17 times more cases, and there will be far more. The last time I ran home to Ireland, this time there's nowhere else to run to. So we have to manage it and fight it. As you will have seen from the news, there has been a lot of announcement concerning hospitals and concerning GPs, but very little about pharmacies. And for anyone working in pharmacy, I'm sure you've noticed already that there's a funnel effect. Patients are being sent away from GP clinics and away from hospitals. There is undoubtedly a funneling effect of people with questions and probably sick people towards pharmacies. And are pharmacies prepared? I don't think so. So I'm going to look at some of the risk factors. I relied in a lot of this presentation on data from the WHO in dealing with Ebola in West Africa. This table is based on a preliminary report on the outbreak and the many healthcare workers who were affected initially. So here are things that can go wrong. There were either insufficient protective policies, project leaders or trainers to implement them properly. There were also issues with the environment. The layout wasn't optimized, that you had sick and healthy people beside each other, or improper cleaning, not enough hand hygiene stations. There were problems with the PPE, which is personal protective equipment. Either there was not enough or it wasn't properly used. There were also cases where staff, if they came upon a patient who was a friend or a family member, they would not be taking the same precautions. There were also problems with hand hygiene, not washing hands sufficiently, touching mucous membranes, or picking up, sharing the same phone without cleaning it off in between. And there were various other things, such as employment issues where people would stay working even though they were sick. So WHO learned. They put better procedures, equipment and training in practice. And the share of healthcare workers amongst the infected dropped from a shocking 12% in July 2014 to 1% about 7 months later. What I'd like to focus on is the 12-fold higher risk is what applies, I believe, to pharmacies nowadays. This is an avoidable, very avoidable 11% risk to healthcare workers and their families. So we'll talk a little bit about pharmacy preparation and provision for this situation, starting with personal protective equipment. I don't believe that pharmacies are adequately resourced. And one of the problems has been the announcement went out, partly from official bodies, that personal protective equipment like masks don't work, which is very misleading. And I'll come to that in a minute. But that, I mean, the idea that they don't work would also not encourage people to use them properly, whereas they are protective. If you look at all the outbreaks, including all the photos of healthcare workers from the Ebola regions, they were wearing their masks. Why? I'll also mention the old-fashioned white coat. I hadn't worn one of those in pharmacy for many years, and now I am again. There are gloves to be worn. I think nitrile gloves are probably more comfortable. And one factor as well, if they are very uncomfortable on your hand, you can maybe put on cotton gloves underneath to stop that very sweaty, uncomfortable, wet feeling. And goggles may be relevant at some point, along with hair protection. The other point is in terms of sterilization. Already we've seen antiviral hand gels have become unavailable. An important alternative is sodium hypochlorite, or Milton solution, in the States known as Clorox. Diluted 1 in 10, that would be the standard thing that I would, wearing my diagnostics hat, use to disinfect anything used for blood collection. The third point is the need to increase personal space. Now, I'm not talking just about the standard thing about keeping a few meters between people. It's also important that the pharmacy design be modified to ensure that people have to stay a little further away from the till and the counter. A GP visited, one of the local GPs in Wexford, where I work, visited us a few days ago and pointed out the simple measure of putting a chair the wrong way around in front of the counter ensures that people, they can't sit in it because the wrong way around, but that they are kept at least the length of a chair further away, and then you've got the width of the counter as well. Another point is that a lot can be done to improve the layout of the store and the dispensary. You want it to be clean, uncluttered, so people don't get stuck in the only available corner of the shop while you have products that would have been very relevant maybe in different times, but not relevant during a health crisis, cluttering up your floor space. So improve the store layout, clear all types of mess away from the counter area, things that people will pick up, put down, touch, sneeze on, breathe on. You understand. They can be sources of infection. They should be gone. Unclutter everything. Equally, if you go to a supermarket, the important thing is not to pick up things and put them down, but choose to pick up only what you really need to pick up. Every contact is a risk. Flu vaccine I have put in brackets. Flu vaccines are no longer, I would guess, being carried out in pharmacies because of the personal space problem, but it's very important, and it's now being done in Beijing. They have increased the rate of flu vaccination for vulnerable older patients. That would include people on immunosuppressants, diabetics, those with lung problems, the elderly in general, because it helps with differential diagnosis, and also you don't want those people who might contract flu ending up in hospital where they could also contract the latest coronavirus. I think it should be accelerated. The other is preparation is boosting your personal defenses. You need to be healthy. It's quite a stressful time. Today is Sunday. Our shop is closed, so we can relax, but the weeks are more tiring than usual because of the anxiety among the public, because of the many questions you have to answer, because of reassuring people that soap and water will do. If they cannot get their hand sanitizers, they just have to use soap and water properly. There's a big educational role at the moment, which I believe everyone is carrying out to the best of their ability, but it's tiring. So you do need to take precautions to optimize your health. Diet is one of the most important things. And training plans and SOPs. Now, SOPs, we are used to in the pharmacy world writing down multi-page, legally documented SOPs. More important than that is having procedures that everyone agrees on, that staff can challenge each other on. If your mask is not on properly, I should tell you, and vice versa. And training we'll come to in a minute. It must be repeated to be effective. One of the things in terms of preparation and safety is a lot of people now don't have access to testing. That will change. Apparently, testing is now to be available for those with symptoms. But if you feel that you have a slight sniffle or sore throat or a tickly throat or whatever, but you think it's only maybe 3% chance that you have the coronavirus, are you going to go for testing? Probably not. But if you have even the slightest suspicion, you should make the assumption that you have the virus. Maybe in a few days' time, it will be clearer that it was nothing or that it is something more serious, and then you will take more serious action. But already at the very first intimation you have something, take precautions. There are many anecdotal reports coming out of Korea. A lot of individual citizen scientists have recorded their own experiences. For example, if they had a slight suspicion, then start wearing your mask, start wearing your gloves, keep distance from your family members. Don't get into lifts with other people, avoid public transport wherever possible. The standard logical precautions. And in such anecdotal cases, admittedly anecdotes, family members did not become ill, even though the person writing the report later was found to test positive. So at the first inkling, act. Don't wait around till you feel bad enough. You can always roll back your interventions if you don't need them anymore. Now, coming on to personal protective equipment again, I was quite shocked at the type of publicity in mass media, including from health professionals and from health authorities, saying that you don't need masks, they probably don't work anyway. And often the proviso at the end was, if improperly used. Now, masks do work. We have a little picture here of a healthcare worker testing someone for fever. That was during the Ebola outbreak in West Africa. Masks do work, but there are many different types of masks. The key is getting a good seal on the mask. There are many different types. You've got simple things that are no better than a piece of tissue paper with some elastics around your ear. They might help protect people on the other side of the mask, but they're not going to protect you. Right up to masks that have carbon filters and are N95, the American standard, or FFP2, which would be the minimum European standard for treating patients with coronavirus, or FFP3, which is one standard above, which would be preferable, but are less available. But you should have them and you should be using them, ideally. Also, in terms of design of these masks, there are some that look a bit like a duck's bill, and we'll have a look at a picture of those later. The duck's bill design, which is quite a big mask out the front, seemed more resilient when doing daily tasks. A Korean study looked at getting people to lift things, turn, bend, or to grimace while wearing masks, and this larger duck's beak mask seemed to stand up to these different types of intervention or movement without losing the seal. So, as I've mentioned, not all masks are equal. You've got very simple masks which prevent infection or splashes going. They protect against infection and splashes on the outside, but they will not prevent things getting through to you when you inhale. But they are more important as source control. They would be used during medical procedures that a doctor or a nurse will not infect a vulnerable patient. Just below that, you can see two types of masks. You see on the left, the rather simple ones. Even the simple ones, some of them have a metal strip over the nose, so you can seal it over the nose to your face shape, and that reduces the risk of anything getting in. And then you have the cup type, which provide a better fit. And then you have officially another type, which in fact it's a very smooth transition between the two groups, of respirators. Respirators are a fitted device that protects the wearer against inhalation of small and large airborne particles. It protects the wearer, and it also protects people who are not the wearer. The key is getting a good seal. Now, when I talked about the duck's bill type, I was talking about the right-hand one on the bottom of this slide. Now, a few tips also from Korea. They have quite a bit of experience there, just as in China. I've been watching a lot of Chinese reports, right up to autopsy reports on the type of gunk that people have in their lungs when they die of the coronavirus. But looking at the Korean reports on mask wearing, they say when you put on the mask, you should blow briefly to see, is it sealed? Is the air, if you feel the air coming out, probably it's not a tight fit. If your glasses fog up above the nose, it means the seal is not tight enough. If the elastic on the mask pulls in your ear too much, what they suggest in Korea is putting a paper clip, or maybe two paper clips, to join the two elastic bits and hook it behind your head instead. Very simple, very clever. So I'll go back to this. FFP2 is considered the minimum standard if dealing with patients. And I've already talked about the funnel effect. There will undoubtedly be people with infection showing up in pharmacies. So here is a further piece of review from the Ebola experience. It's not only important how you wear equipment, but also how you remove it. And it's important to guarantee supply. So even with equipment, if it's not removed properly, if you handle a potentially infected part with let's say a hand that you've removed a glove from, you risk infection. There's also the impulse to touch your face, wipe away sweat, use phones. So further learning is that you need an adequate supply of personal protective equipment, along with a ritualized process for putting it on and taking it off. And these are desperately needed to prevent unnecessary infection and loss of life. Protection does not happen by accident. It is achieved through provision of adequate PPE and especially a focus on processes that will ensure that the PPE is used safely. So just a word on training. This is a report on training that was not done in Ebola area, but it was done on a different site. Training on personal protective equipment, goggles, masks, and caps. And after the first training, the error rate, the critical error rate, in other words, an error that would cause an infection if it happened in a real life situation, was around 10%. After the second training, it was around 6.7%. By the third, it was down to 0. In other words, train, and train again to get it right. Is 10% an acceptable infection rate for our colleagues and for ourselves? Clearly not. They also looked at introducing much more complicated protective equipment that was more difficult to put on and would protect people better. But the more complicated, then the more difficult it was to achieve an error-free use of the equipment. So what we work with what we have, but use it to the best of our ability and train to the best of our ability. So coming down to the individuals, we have to prepare ourselves. Stressful situations, and this is my experience, and no doubt yours as well, typically lead to risky dietary behavior, eating sweets and biscuits, and that's not a good thing. I'm not saying you can't have treats, especially if people like to go to a pub, can't go to pubs or restaurants anymore. So you do not want to fight a very potent infection. If up to 20% need to be put on a ventilator, you don't want to be one of those. So you don't want to fight this potent infection with one hand tied behind your back. In your diet, focus on exchanging less healthy foods for more, in other words, take out less healthy and include more micronutrient and antioxidant dense foods. There's no shortage of them in the supermarkets, so increase your variety of vegetables. And if you are ever going to eat organ meats, now would be a good time. They're particularly good reservoirs of the key vitamin B vitamins and the fat-soluble vitamins. Also look at the supplements. I did a lot once the first reports came. I looked back at the reports from 2003, researched on supplements that would combat the coronavirus, and there are plenty of reports. So look at things that may help. They may not have been adequately documented, but they're safe, and they may certainly improve your resistance to the infection. I would also say, as a general procedure, the B vitamins are vital for formation of your various blood cells, including your white blood cells. So you want to be sure you have a full complement of B vitamins. So I would say, just in general, do a B complex for 2 weeks. For most people, that will probably tank up their vitamins. You certainly want to tank up your vitamin D. Vitamin D is critical for antiviral defenses and has been shown in many, many studies. It's less beneficial if you already have achieved sufficiency, but most people in Ireland have levels of about 40 nanomole per litre, whereas medical sufficiency is somewhere around the 85, and natural 2 weeks in Spain would give you 120, 130 nanomoles per litre. So I would say you should be aiming for around 100. So making the assumption that most people are around the average, the 40 nanomoles per litre, it's probably lower than that in February and March. A dose of 2000 IU per day of vitamin D3 for the next 12 weeks would be safe. It would be a good thing to have your levels checked, though, at your next medical checkup opportunity. If you are vegan or vegetarian or taking proton pump inhibitors or metformin, your levels of B12 will be depleted. It can take years for B12 levels to deplete initially, because the liver contains a much longer, even though it's water soluble, it contains a much longer stock than of most of the B vitamins. So if you're in any of those categories, take a B12 spray. You need it to make your white blood cells. So the other thing is taking personal responsibility for yourself, your colleagues, and your families. If you have coats and shoes that you wear at work, don't bring them into the inner sanctum of your house. Leave them at the door, leave them in the car. Put your stuff into a plastic bag when you leave work. Bring it to the washing machine. Cook it at the highest temperature. White things you can put in Milton solution, dilute 1 in 10 to disinfect. So you do not want, as a health worker, to become an undue risk for your family and colleagues. The other thing is, particularly, I'm a little bit shocked that there has been so little guidance from the Pharmaceutical Society here in Ireland or from corporate pharmacy. We are, after all, scientists. Everyone who works in a pharmacy is a scientist. We're used to dealing with things scientifically, looking for information, passing on the right information. If we're all scientists, shouldn't we be studying coronavirus and learning what may help? The other thing is to prepare your patients. So if you can get the vulnerable vaccinated against flu, again, as I mentioned, diabetics, vegans, vegetarians want to have their B12 levels checked if they go to the GP. And in the meantime, anyway, you're not very unlikely to overdose on B12 in the next 2 or 3 months. Take a B12 supplement if there's any suspicion you might need it. The same for vitamin D. And another point, the shops are being stocked up with paracetamol and ibuprofen. Remember, the fever is part of the immune response. It may be, so a large part of the treatment with these antipyretics is for comfort reasons only. For relatively harmless things like the common cold, it does no apparent harm to be using anti-fever drugs. But this is a more serious issue. I would, just as general advice, caution that fever is a good thing. Sleep is also a good thing. So if there's a spike in fever at night and you can't sleep or your patients can't sleep, of course, something like paracetamol is a good idea. But it's not a matter of just trying to keep your temperature normal. Fever has a very important role in our immune defenses. I have done my researches on drugs that were tested and supplements tested in 2003, and some of the things that seem to have potential. Unfortunately, since SARS disappeared, the studies were never completed, but substances with promise were echinacea, licorice root. You can get it in a health food store, if not in your pharmacy. There's a little bit of data on L-lysine, very little human data, but it's certainly worth examining as an antiviral. There have been studies in nursing homes that would help reduce the risk of infections, chest infections in winter. Liposomal vitamin C, sort of parenteral vitamin C is being trialed in China at the moment. We don't know the results yet, but it's a harmless thing. Liposomal has the advantage to get much higher blood levels. It's a fat-coated vitamin C rather than taking large amounts of normal vitamin C, which would be either peed out or will cause diarrhea. So I know of 2 producers. There's the international brand Altria C, and in Ireland there's Porebsky liposomes in Bray. I would say they're not a bad thing to have in your fridge, either if you suspect you have an infection starting or as protection during a situation where it has become embedded in your community. And again, short-term B-complex to shore up any possible deficiencies. And as ever, a good diet, a better diet than in the past, will help shore up your immune health. So, second last slide, checklist. So make sure staff is informed and trained on how to use their PPE. Make sure they have PPE. Make sure there's an adequate stock, that there's white coats, there are work shoes, coats, overalls, and gloves, that one staff member checks on another staff member's preparations daily. Maybe it would be a good idea, as learned from the WHO experience, to have a store champion, somebody who helps coordinate the activities in the store. I'm sure there'll be a natural champion with OCD in every shop. The other thing is to improve store layout, fix the counter areas, increase the space in the till, control the flow of people in or out, or at least make sure they are adopting a space between them to minimize the risk of infection. If you're using air conditioning, make sure you know where the air is coming from. If it's recirculated air, it's probably not a good idea. If you have doors and windows, it might be no harm to let the air circulate a few times during the day, weather permitting. Cleaning procedures. At present, we are closing the pharmacy in Gorey County, Wexford for an hour at lunchtime. Gives us a chance to catch up on the work from the morning because we spend so much time answering questions. We are going to now start using a UV air disinfectant, UV light air disinfectant in our consultation room and in other areas, for example, the toilet, canteen areas or whatever. And to carry out surface disinfection using Milton solution diluted 1 in 10. However, the surface should be clean before you use the Milton. It doesn't work if there's other organic material on it. So challenge your suspected case procedure as well. If somebody comes in who is a suspected case, who is coughing or even they themselves suspect, how are you going to consider how and where you're going to deal with them in the shop? Who will deal with them? Have you the equipment to deal with them? And what you do afterwards? Ideally, you'll also prepare a sticker with relevant information, HSE numbers, where to go to give to potential coronavirus patients, to shorten the discussion and also give them valuable information rather than having them come back with additional questions. There's a lot you can do in advance. And I suppose, again, PPE, make sure it's a snug fit, a bit like a scuba mask. You want it to be good. Now, recycling, I have to talk about this because so far it looks like we will not have adequate stock of masks. There have been a number of studies done. Now, this is not the recommended policy, but there have been a number of studies done suggesting that if you thoroughly wash in Milton diluted 1 in 10, this is the better masks, not the cheaper ones that might fall apart, that you may still maintain the barrier function having disinfected a mask. Now, this is definitely not top priority, but when you run out, you run out. You've got to do something. Somebody joked to me today that maybe we should go around hospitals from sick people and collect their masks. That is definitely not the way to go. So I wish you good health and good fortune and preparation in the coming months. If you'd like to add some comments, I'll certainly be happy to update this video. Please prepare well, take this seriously in order to save